Good morning. Can you hear me? I'm Mary Kay Fox, a member of the committee, and I have the pleasure of introducing a number of speakers that we'll be hearing from this morning. Our first session, we have two speakers from the USDA-Center for Nutrition Policy and Promotion, otherwise known as CNPP, and they'll be providing a summary of key changes in the 2015 Dietary Guidelines for Americans and the relevance of these changes to the deliberations we're undergoing about the WIC food packages. Our first speaker is Dr. Rebecca Schaap. She's the lead nutritionist for the Nutrition and Economic Analysis teams at CNPP. Dr. Schaap leads a multidisciplinary team that conducts analyses of the USDA food patterns and the Healthy Eating Index, as well as expenditures on children by families. She'll be joined by Dr. Essery Stoody, who is the lead nutritionist of Nutrition Guidance at CNPP. One of her primary roles is to support the Dietary Guidelines for Americans revision process. Dr. Stoody and her team assisted both the 2010 and 2015 Dietary Guidelines Advisory Committees throughout their deliberations, and they are currently coordinating efforts to inform development of future dietary guidance to a group that's warm and close to this WIC committee, dietary guidance for infants from birth to 24 months, as well as for pregnant women. Welcome, Dr. Schaap. We'll have you come up first. Or actually, you're coming together. I forgot about that.
Okay, we're going to slightly swap this a little bit. I'm actually Eve Stoody, so I'm going to kick us off, and then I'll pass it over to Rebecca. Okay, so as I noted, my name is Eve, and I'm going to summarize information from the 2015-2020 Dietary Guidelines, particularly that information that is relevant to young children and women. And I'm then going to turn it over to Dr. Schaap, who will highlight dietary intakes of young children and women compared to the recommendations in this edition of the guidelines. So this edition of the guidelines was released on January 7th of 2016, and just to give you a little orientation to this edition, it has an executive summary, an introduction, and 3 chapters. And as you can see, all 3 of the chapter titles include healthy eating patterns. This highlights that eating patterns is the major focus of this edition. An eating pattern represents the totality of all foods and beverages consumed. All foods consumed as part of a healthy eating pattern fit together like a puzzle to meet nutritional needs without exceeding limits for calories and other aspects of the diet. Eating patterns as a whole may be more predictive of overall health and disease risk than individual foods or nutrients. The first chapter describes the key elements of healthy patterns, and this includes much of what I'm going to highlight today. While the dietary guidelines describe key elements of healthy eating patterns, the guidelines embody the idea that a healthy eating pattern is not a rigid prescription, but rather an adaptable framework in which individuals can enjoy foods that meet their personal, cultural, and traditional preferences and fit within their budget. The second chapter discusses current intakes in the U.S. and describes shifts that are needed to align current intakes with healthy eating patterns, and this is much of what Rebecca will discuss today. And then the third chapter discusses how everyone has a role in supporting healthy eating patterns. There are also 14 appendices that support these key chapters. So this edition begins with 5 guidelines that are built upon throughout the policy document. Those guidelines are to follow a healthy eating pattern across the lifespan, focus on variety, nutrient density, and amount, limit calories from added sugars and saturated fats, and reduce sodium intake, shift to healthier food and beverage choices, and support healthy eating patterns for all. The components of healthy eating patterns recommended in this edition of the guidelines were developed by integrating findings from systematic reviews of scientific research, food pattern modeling analyses, and analyses of current intake of the U.S. population. Systematic reviews of scientific research examine the relationships between the overall diet and its constituent foods and beverages and nutrients and health outcomes. I will note that most of this evidence is on adults, but our advisory committee, who helped support the review of the scientific evidence, acknowledged that the same patterns do apply to children. Food pattern modeling assesses how well various combination and amounts of foods from all food groups would result in healthy eating patterns to help meet nutrient needs and accommodate limits such as those for saturated fats, added sugars, and sodium. I'll note that the patterns aim to meet the dietary reference intakes, particularly the RDAs and the AIs. Analyses of current intakes identify areas of potential public health concern and ensure recommended eating patterns are realistic and attainable. So again, the findings from these different methodologies were integrated so that the amounts recommended in the next slide that I'll show reflect eating patterns associated with positive health outcomes and that support nutrient adequacy. So since the focus of this presentation is on the key changes in this edition, I wanted to start by stating that the core elements of healthy eating patterns have really remained the same. So this slide shows the 2015 Healthy U.S. Style Eating Pattern, and that is on the left, and the slide formatting got a little strange, but on the left you see the Healthy U.S. Style Eating Pattern, and that's in the 2015 Dietary Guidelines. And on the right, you see the 2010 USDA food pattern that's in the 2010 Dietary Guidelines. And this is an example from the 1,400 calorie level. And just as a reminder, I know that y'all have spent some time with these patterns. There are 12 calorie levels from 1,000 to 3,200 calories. And so this is the 1,400 example. So if you do a side-by-side comparison, you can see that the quantitative recommendations for the food groups and the subgroups have remained consistent from 2010, and literally they're just exactly the same across the patterns. I'll also note, I know you've done some work looking at the 2015 Advisory Committee's report, and the recommendations and the guidelines are the same as those that were in the advisory report. So we didn't change anything from the 2015 advisory report patterns to what's in the guidelines. So if you'll notice at the very bottom here, there is one difference, and that is on the limit for calories for other uses. This is the number of calories that remain after food group and nutrient needs are met with nutrient-dense foods. So these calories are actually not new. We've always kind of referred to these within the patterns. In 2005, these were the discretionary calories. In 2010, these were the calories from SOFAs, or solid fats and added sugars. And in this edition, we refer to them as the limit on calories for other uses. And the reason why we did that is really because we see people use them in a number of ways. They may use them for added sugars. They may use them to choose higher fat, whole milk. They may use them to consume an additional serving from a food group. They may choose for adults to consume alcohol. And so there are a number of ways that those calories are used. And so this is the exact same concept. It's just a slightly different presentation of the terminology. So you'll notice also a slight difference in the number of calories for other uses. So in 2015, it's 110 calories, and in 2010, it was 121. And I'll just say, when we update the patterns, we update food consumption data and also intake distributions. And so that's really just a reflection of updating the databases that support the analyses. So it's not an actual intentional change to the foundation or the actual pattern itself. So while the quantitative recommendations that I just reviewed are the same, there is some additional guidance in the text of the policy document related to the components of healthy eating patterns that I think may be relevant to your target population. The dietary guidelines discuss that a healthy eating pattern includes a variety of vegetables from all of the subgroups, dark green, red and orange, legumes, starchy, and other, and there's really no change of focus or emphasis on that from 2010. It's the same general recommendation. The guidelines recommend fruits, especially whole fruits, and whole fruits include fresh, canned, dried, and frozen. The dietary guidelines do recommend that less than half of fruit be 100% juice. The guidelines recommend grains, at least half of which are whole grains, and when refined grains are chosen, they should be enriched, and when all whole grains are chosen, some of them should be consumed that are fortified with folic acid. A healthy eating pattern also includes fat-free or low-fat dairy, including milk, yogurt, cheese, and/or fortified soy beverages. And the DGAs do note that increasing the proportion of dairy that is fat-free or low-fat milk or yogurt and decreasing the proportion that is cheese would decrease saturated fats and sodium and increase potassium, vitamin A, and vitamin D provided from the dairy group. The guidelines recommend a variety of protein foods, again emphasizing seafood, lean meats and poultry, eggs, legumes, and nuts, seeds, and soy products, and there's really no change in that recommendation from 2010. And we continue to recommend oils as the primary source of fats. Additionally, a healthy eating pattern limits saturated fats and trans fats, added sugars, and sodium. So this slide highlights a few quantitative recommendations for components of the diet that should be limited. And the first that you see there is to consume less than 10% of calories per day from added sugars. The added sugars recommendation is a target based on food pattern modeling and national data on intakes of calories from added sugars. And we do see that when added sugars exceed 10% of calories, a healthy eating pattern may be difficult to achieve. So the 2010 edition did include, as you just saw on our quantitative slide, a recommendation for calories from solid fats and added sugars. And so in general, in 2010, there was a recommendation that there was around 5 to 15% of kind of these extra calories for solid fats and added sugars. But this is the first time we have a true quantitative limit for added sugars alone. The second there is to consume less than 10% of calories per day from saturated fat. And this recommendation is a target based on evidence that replacing saturated fats with unsaturated fats is associated with reduced risk of cardiovascular disease. And a major emphasis for us is the replacement message, that it's not just about reducing saturated fats, it's about reducing saturated fats and replacing them with unsaturated fats. And this is the same emphasis that we had in 2010. However, we also acknowledge that replacing saturated fats with carbohydrates is not associated with reduced risk of CVD. And then the final that you see there is to consume less than 2,300 milligrams of sodium per day. That is for individuals 14 years and older. Of course, for those younger than 14, the recommendation is to consume the age and sex-appropriate dietary reference intakes, or the tolerable upper intake levels of the DRIs. And for young children, those are, of course, around 1,500 to 1,900 milligrams per day. So before I turn it over to Tusa Rebecca, I wanted to spend just an additional minute on the limit on calories for other uses in its relation to the limit on calories for added sugars. This slide shows that the limit on calories for other uses really varies across the 12-calorie level of the patterns. For some, particularly the higher calorie levels, there's a lot of room for this limit. So if you look at this graph here, the green represents how many calories are available for those other uses. And again, from the 1,000 to the 3,200 calorie limit, you can see that that range is really from about 100 calories to about 600 calories. The blue triangle is the limit for added sugars at 10% of calories per day. And the point here is to note that the 10% is really a target. There are certainly some cases where there's actually not enough calories available to have 10% of calories per day. And particularly when you think of that's a limit on calories for other uses. You can use that for saturated fats or for consuming additional food from other food groups. And so it's not a hard and fast number that applies to everyone. It's a target to help move people towards healthier eating patterns. So with that, I'm going to turn it over to Dr. Schaap, who will highlight how the current intakes in the U.S. compare to the recommendations that I reviewed.